Welcome to Keeping It 100 Coalition Conversations. I'm your host, Shanice Lewis. This is the official podcast of the National Coalition of 100 Black Women, Metropolitan Baton Rouge Chapter. Today, we're highlighting the upcoming event, the Pink Fascinator Tea, taking place Saturday, October 5th, and as well as the Health Committee's other initiatives. And we have some very special guests today, Dr. Mindy Bowie and Dr. Renee Cowan, who will tell us about women's health and cancer. So we have a very informative, jam-packed show today. Thank you for tuning in. And we're going to start off with Dr. Bowie. Let's bring her to the stage. Hi, Dr. Bowie.
Hi, how are you? Good evening.
Now, Dr. Bowie, for those of you who don't know, is a breast surgical oncologist at Mary Bird Perkins Cancer Center. And you were our speaker last year at the Pink Tea Fascinator,
I
correct?
was. Yes, and it was one of the most beautiful, well done events I have ever been to. Just the pink and the spirit and the energy in that building that day was absolutely phenomenal.
Well, thank you so much for supporting us. And so I have a lot of questions for you today because breast cancer is something that's an important topic. And we always see the pink ribbons, but everybody might not know the details of how to prevent it for themselves. So we know 1 in 8 women will be diagnosed with breast cancer. What are the trends you see as it relates to age and ethnicity?
So, Caucasians are more likely to be diagnosed with breast cancer than African American or Hispanic women. However, African American women, especially, are more likely to be diagnosed at a more advanced stage and also more likely to have a more aggressive type of breast cancer called triple negative. With regards to age, as you age, your relative risk does increase. So we say 1 in 8, but in your 30s, it's 1 in 200. In your 40s, it drops down. So it's over a lifetime period. It's the 1 in 8 that you'll hear that trend. Median age for diagnosis is usually around 62 years of age. But again, it is we don't want to always say it's a diagnosis of the elderly. I've had a 19-year-old with breast cancer, but understand your 20s, your 30s, your chances are much lower than in your 50s, 60s, or 70s.
And what about your family history? How much does that
Fa-
affect it?
Family history is always important. However, this is a staggering statistic. 70% of women that are diagnosed with breast cancer have little or no family history of breast cancer. I diagnose women every day and they tell me, how can I have breast cancer? I have no family history. And I tell them, well, you and 70% of the patient population. Yes, family history is important. Yes, family history of breast cancer does increase your risk. But by all means, please do not think you cannot get breast cancer because you have no family history, because out of all the women out there that are diagnosed, it's actually more likely that you will not have a family history.
Wow. So is getting an annual mammogram enough to catch breast cancer early?
Very good question. So we still in 2024 say that a mammogram is the best screening tool for the early diagnosis of breast cancer. However, there is a subset of the patient population that may benefit from getting a mammogram earlier. We usually say average risk begin at the age of 40. However, if you have a significant family history of breast or ovarian cancer, if you have a personal history of abnormal cells in your breast, family history of male breast cancer. So it all depends on the risk factors. That patient may benefit from screening at an earlier date, an earlier age, and possibly incorporating more imaging modalities rather than just a mammogram, such as an MRI. MRI is the most sensitive study for detection of breast cancer. However, unless you have a diagnosis of cancer or are high risk, insurance companies will not allow an average woman to usually get a screening MRI. But again, there are a subset of patient population that will benefit from that MRI. Their insurance will cover that MRI. Insurance companies like to see a certain risk. That risk is usually 20% lifetime risk or greater. And if that is the case, insurance is supposed to cover having a yearly MRI. Now, that does not take the place of the screening mammogram. The screening mammogram is still very important, but it would be used in conjunction with that screening mammogram as well.
Now, I got my first mammogram at the age of 40. In my very first mammogram, I had to have a biopsy. I thought I
Yes,
was
ma'am.
about to die. So
Yes,
I
ma'am.
think it was because I have dense breasts. Now, what
Yes.
is this dense breast? What does that mean?
So it is very important every woman be educated about breast density, know what the breast density is and what does that mean. So first and foremost, there are 4 stages or categories of breast density, from very fatty replaced to scatterfibroglandular, heterogeneously dense, and extremely dense. So one goes from not dense at all to the other extreme of very dense. The more dense the breast, the higher or the more increased risk you are for development of breast cancer, because breast cancer forms in the dense part of the breast rather than the fatty replaced part of the breast. So it's very important. Not only that, is the more dense your breast is, the harder it is to see a cancer on mammogram. So these are the patient population that maybe they would benefit from a supplemental ultrasound. If they have that family history or those other high risk factors, they would certainly benefit from a high risk MRI. So again, I tell every lady, know your breast density. It is mandated in the state of Louisiana that that breast density has to be reported on that mammogram report. So if you're a lady out there and you have your mammogram report and you want to know your breast density, look at it. Again, 4 categories, 1 being not dense at all, 4 being the most dense.
So does the size of the breast have something to do with the density? Because I'm
No,
heavy
not at
chested.
all.
It's not related.
No, not at all. Unfortunately, I usually say it's what the good Lord gave you. It's a lot of hereditary components to it. Hormones can affect breast density. And of course, as we age, most of our breasts become less dense and more fatty replaced. That being said, I've seen an 80-year-old with that extremely dense breast. I've seen a 20-year-old with a completely fatty replaced breast. So again, these are all guidelines, but not every patient is going to follow all of the rules. But breast size does not necessarily mean what your breast density is going to be. And here's one other point: what you feel if you do a physical exam, which I do highly encourage physical exams, but what you feel in your breast does not necessarily relate to breast density. In other words, you can touch your breast and it feel very dense, but that's not what we're talking about on breast density. We're talking about what it looks like on a mammogram. So that's really important to be able to distinguish between. It's not just necessarily what you feel, it's what you're seeing on a mammogram.
Okay, now this is a question I have from a friend. She says, why are additional tests recommended for individuals with dense breasts beyond a standard mammogram? And why aren't those additional tests always fully covered by the insurance, leading to higher costs for something patients cannot control?
You are you that is an excellent question, and I will tell you it is something that is being brought forth to legislation every single year. Um, I will tell you, stay tuned, because I think there will be a day that insurance companies are going to be mandated to perform or to allow a patient to get a screening ultrasound in addition to their screening mammogram. In other words, free of cost as part of their yearly examinations based on their breast density. We are not there yet, but legislation has been being pushed with regards to this. Now, some insurance will cover it. Some insurance will say there's like this low deductible associated with it, but we're looking and hoping for the day that it is just mandated across the board, all insurances to cover it. And to go back to why would they need supplemental imaging if their dense, if their breasts are really dense? It's what I alluded to a little while ago. The breast density appears white on a mammogram. So the more dense your breast is, the more white that mammogram.
Uh-oh, we lost Dr. Bowie, and she was in the middle of an amazing uh answer. Oh, there she is.
Yes. Yes.
You're back.
Oh, can you hear me again?
Yes.
Okay, so I wanted to say, so you can get that masking effect. It's harder to see the cancer on a mammogram when you have dense breast. Therefore, that supplemental ultrasound is often recommended.
Okay. So explain the process a woman might go through to be diagnosed.
Okay, so a diagnosis, we like for women to be diagnosed based on their mammogram because that's you if they're having their yearly mammogram, the earlier they can be detected, the better. However, if you're getting your mammogram and you feel something in your breast and they see nothing on your mammogram, but you can feel it and your provider can feel it, that is a sure sign that you possibly need another supplemental image like an ultrasound. So let's just say we see an abnormality on the mammogram. We're going to see if we see it on ultrasound. If we see it on ultrasound and it looks abnormal, that patient will undergo an ultrasound guided biopsy. And that's a needle biopsy. That is not a surgery. The patient is awake, a little bit of lidocaine. They can drive themselves. They go home the same day. They can eat food. It is a procedure, not a surgery. If that abnormality is
And
only
that's
seen
when
on a mammogram,
they take a chunk of meat out your breast, right?
no, ma'am. That. This is just done with needles. Okay, so
Okay.
there's no cutting like in a surgery. It is just you get a shot of lidocaine, like going to the
Hmm.
dentist. You get the shot, then it goes numb, and then we put a it's a large needle, but a needle into the breast, and we take a small little piece out of that breast. So let's say the mass is like a little grape. We only take a tiny, tiny little bite out of that grape. That goes to pathology to tell us what it is. You do not require stitches, a little butterfly band aid on it. You can drive yourself, you get to go home the same day. It's really easy peasy. Whether that be using the mammogram to do the biopsy or using the ultrasound to do the biopsy, biopsies like that can be done same day, out day procedure, not a surgery. Patients can drive themselves, no stitches required, go home right after the procedure.
Nice. So, what new innovation have you seen in surgical options that you consider improvement over the last 10 years?
We have made uh, leaps and bounds of improvement. Unfortunately, I still see women today that are being treated for breast cancer, even in Baton Rouge, that are doing it like we did it 30 years ago. And it breaks my heart. Gone are the days that women have to look mutilated or are not like a woman afterwards. So I will tell you the biggest change is the options for reconstruction, whether it be removing the whole breast, giving them an implant, or using their own body's fat, such as fat from their abdomen, to make them a new breast. Even if we're doing lumpectomy, that means the lady is going to keep her breast. We like to do what we call symmetry surgery. As we age, our breasts tend to go south, if you know what I mean. So
Yes.
what we do, and insurance covers every bit of this. If I do a lumpectomy, in other words, I remove cancer, but she's keeping both of her breasts. We take her breast, both breasts, make them symmetric, and we lift her breasts. It's almost like she went to the plastic surgeon and had a little breast reduction and a lift. But because cancer is being removed, insurance covers every bit of it. That's a day surgery. Women are coming out of these cancer operations telling us they look better after their cancer treatment than they did before. And what an amazing achievement for women to be able to still look like a woman, feel like a woman after her treatment for breast cancer.
So, do all surgeons offer these things you talk about?
Unfortunately, no. They should, but they don't. And that's one of the things that break my heart is that these should be given, these options should be given to every woman out there, because it does not, regardless of your insurance status, even Medicaid in the state of Louisiana covers reconstruction for breast cancer. So all women should be offered this. So the biggest movement is doing less surgery, less axillary surgery, giving less comorbidities or side effects long term, and to have a nice cosmetic result long term as well.
So if somebody is listening to us and watching us today and they like how you are talking about breast cancer, you're very knowledgeable, are you accepting new patients?
Of course we are. I'm at Mary Bird Perkins Cancer Center, which is the largest cancer center in the Louisiana and in the Deep South. And we accept patients. You can be referred. We also accept self referrals. So you don't necessarily have to have an abnormal mammogram or a mass or a diagnosis of breast cancer. If you have a family history, or you have had abnormal cells in your breast, or if there's any issues with your breast, we take self referrals as well.
So I wouldn't come to you unless I'm diagnosed with breast cancer, or
No,
I could
ma'am.
come
So
before.
I am a breast surgical oncologist, so my area of expertise is breast cancer surgery, but I also have a high risk clinic. And this is women that do not have a diagnosis of breast cancer, but they're at high risk, whether it be for their family history or other factors. We see women without family histories that maybe have an abnormal mammogram. They need a biopsy. I do all my own biopsies. So if a woman has an abnormal mammogram and she needs a biopsy, she can come see me. If a woman has an abnormal mammogram and she just needs a 6-month follow up, she can come see me. We take care of all of that. If it is anything going on in the breast, we see and we take care of.
And if somebody feels they're not getting good treatment somewhere else, they could come to you for a second opinion.
Absolutely. We always encourage second opinions.
Well, awesome. Well, thank you so much for taking the time to talk with me today. I know you are super busy and you got an event to go to, but thank you for always supporting our organization.
Absolutely. Thank you for inviting me. I really enjoyed it.
Thank you. Hope to see you again
Okay.
soon.
Thank you. Bye bye.
Bye-bye. So that was very informative. I hope you all get your mammograms every year. I'm going to have to go schedule mine now. But now we're going to move from the breast to the vagina. You know, cancer can go all over your body. So we're going to learn about gynecological cancer. And we have Dr. Renee Cowan. She's a gynecologic oncologist at Women's Hospital. Now, did I say your name correct? Unmute yourself. You muted.
You did say every. Oh my goodness! Look at that. My house has been absolutely silent up until this moment. But
That's
since we're
okay.
keeping it real, I've got a baby here that is crying. If you give me 1 second, let me get him
Okay.
to his father.
Okay. Well, I will go to our health committee chair, then come back to you. So we're going to give her time to get her kids tucked away. And now we're going to go to our health committee chair, Angela Norwood. You're muted, so you have to unmute yourself.
Hello.
Hi. So we just got through talking to Dr. Bowie. Wasn't that some great
Oh,
information?
she was wonderful. She was wonderful. She was great last year at our Pink Fascinator Tea event. She was our speaker, and oh gosh, she was so wonderful last year.
And so speaking of the Pink Fascinator Tea, the big event that is highly anticipated is coming up October 5th, and tickets are almost sold out. So at the time of this show, there are only 15 tickets left. So they're either going to be gone by the end of this show or the end of the night.
Exactly. So we're honored to have Dr. Constance Blunt from Mary Bird Perkins as our guest speaker, who will be discussing crucial signs and symptoms and treatment options for breast cancer. In addition to that, Dr. Blunt will talk about Dr. Blunt's talk, we will also have vendors there providing valuable information and resources for all those affected by breast cancer. And like you said, tickets are $30. They're available on Eventbrite, and they're going fast. As you said, how many we have left? 15 left?
15.
Oh,
And we
goodness. So
will
you
not
better
add any more
grab them.
tickets.
You better grab them now before they sell out. We are still taking sponsors for this event. And if you'd like to be one, please email us at healthncbwmetrobr or email info@ncbwmetro.org or go to our website at ncbw.org and click donate and go to health. And with that being said, three of our sponsors are Women's Hospital, Maryburg Perkins, and Ochsner for this Pink Fascinator event.
So this is going to be a sold out event for sure.
Sold out
by tonight. So if you missed it this year, we're probably going to have a bigger venue next year because this is a big event. This is one of our, one of our great events that people look forward to. And so in addition to the Pink Fascinator Tea, the Health Committee also has a raffle going on you didn't tell me this is the Pink Fascinator Tea flyer. So if you want a ticket, you can find this on our social media pages. Or if you are looking on your laptop, you can scan that QR code and purchase your ticket right now while you're watching the show. So Pink Fascinator Tea, October 5th. Now, the Health Committee also has a raffle going on for a Brahmin beautiful leather bag. Tell us about this raffle.
Look at that stunning Brahmin Weekender bag. It's worth $495. Raffle tickets are starting at $25 with a bundle of $40 or for 2 or $100 for 6. So this raffle supports our ongoing health initiatives, including the Pink Tea Fascinator Tea, the Be Healthy 100 Health Fair, which has gotten large also. And also our Be Gentle with Our Mental Health series. And also this year, we're going to focus also on maternal health. So don't miss out a chance to contribute to our mission for advocating for young Black girls and women. And you may even win this beautiful bag because I'm going to purchase a couple of tickets because I want that bag.
Now this, do you have to be present at the Pink Fascinator Tea to win this prize?
Oh, no, you don't. You do not have to be present to win this prize. We're going to announce it on October 5th at the Pink Tea Fascinator. But if I were you, I would go ahead and buy a ticket, buy a raffle ticket, and buy a ticket to the Pink Tea Fascinator event before it sells out.
Yes. So definitely support this to support the Health Committee and all of their amazing initiatives coming up. But the Health Committee is very busy because they still have another project, the Bus Bra Cancer Community Fundraiser Challenge with Women's Hospital. Now tell us more about this.
Oh, we're just so excited. The National Coalition of 100 Black Women with this breast cancer fundraiser with Women's Hospital. This event features breast cancer survivors modeling beautiful bras and outfits created by local designers. But two of our coalition sisters, Faith Wong and our third vice president, Nashawn Stover, are among the designers for this year's fashion show on September 19th at Crown Plaza. We are so excited. It's a celebration of survival, life, and resilience. So come on out. And also, our committee, we had a little bus bra decorating contest among our coalition sisters. And shall I say, we have some creative sisters, Sister Shanice in our organization. So we're proud to share our specially designed bra eating made by our coalition sisters, Martina Domino, Shanika Johnson, Rachel Mitchell, Tamika Thompson, and Richland Wimberly on social media soon. Can you all see the bra? Can you all see it? Is it showing in the...
Wait, let me take the flyer down to see. So you actually have the real bra in your background.
Yes, I have the real. Look how beautiful that bra is. Look how gorgeous this bra. So what we want you to do, we'd love you to support us to reach our goal of $1,000 for this great cause with Women's Hospital. Every dollar counts. So you can vote for our bra by texting BUST 41 BUST 41 to 7177. BUST 41 to 7177. So go ahead and donate.
And we'll have that information on our social media tomorrow. So the money for the bus bra goes to the Women's Hospital Foundation, correct?
Yes, correct.
But the money from our Brahmin raffle goes directly to Metropolitan Baton Rouge Chapter. So not only are we doing things for ourselves, we are partnering with people in the community to support breast cancer as well.
Exactly. Thank you, Sister Shanice. I appreciate you so much.
Well, thank you. So if there's anything else, I'm going to move on to our next doctor to see what we can learn about gynecologic cancer. So thank you. Did you freeze?
Oh, no, thank you. Did I?
Right.
Look,
Okay. Thank you so much. Okay,
Thank
so now we're coming back to Dr. Renee Cowan. Hey, you ready?
I am. There might be a baby here. We're just going to keep going. I've tried
We
my best to get
understand.
rid of this child.
So, September is a month that, tell me about what the September month is, because we all know about breast cancer, but this one is not as popular.
That is very true. We do all know about breast cancer, but September is GYN Cancer Awareness Month. And what that means, the GYN cancers, or GYN is gynecology, and those are the women organs or the lady parts. That is your uterus, your fallopian tubes, your ovaries, your cervix, your vagina, and your vulva. Some people don't even know that all those parts exist, but basically anything below the belt can get a cancer and does get cancer. And so there's an entire subspecialty of OBGYN dedicated to treating these cancers. And that is what we do over at Women's Hospital.
So can you give us an overview of the different types of gynecological cancers and in the Black community and why it's so important to focus on these cancers specifically within our community?
Absolutely. So the cancers are the same amongst all the communities. To start with the Black-white disparity, some of the cancers are more common in white women and some are more common in Black women. But across the board, regardless of whether the cancer is more common in Black or white, the rate of death or the mortality is higher in Black women, unfortunately. And that is for a multitude of different reasons, some of which we know, some of which we don't know. The major cancers, our most common GYN cancer is the cancer of the uterus. Now, the uterus has two parts. It has the inside part that you bleed from every month during your reproductive years when you have a menstrual cycle, and that's inside the womb. That's where the baby grows, and that's the endometrium. And so that can have you an endometrial cancer. Then the outside part is the muscle layer, and that's called the myometrium. And that's where you can have fibroids. If you get cramps during your monthly cycle, that's that muscle that's contracting and causing those cramps. And that can get a cancer as well. And there are different types of cancers that it can cause, that you can get there as well. But the cancer of the lining is our most common cancer. It's also our most curable cancer because it's the one that usually has a symptom, and that is bleeding, abnormal bleeding or bleeding after menopause. That is my every year I go on a soapbox with marketing. Last year I was obsessed with people looking at their vulvas and looking at their vaginas. This year I'm obsessed with postmenopausal bleeding. It is not okay. Once you've gone through menopause and you have not had bleeding for 12 months, you should never bleed again. And anytime you bleed again, I don't care if it's just a drop of blood, you go to your gynecologist. And if your gynecologist ignores you, you go to a different gynecologist. And that is my soapbox for the year.
So, what are some of the early signs and symptoms of gynecological cancers that women should be aware of? And are there some symptoms that are overlooked or mistaken for other conditions?
Well, yes. So I guess I didn't touch on the other four cancers, because then the fallopian tubes and ovaries, they can give you a cancer. And then the cervix can give you a cancer. The cervix is the opening part of the womb. Like if you've ever had a baby vaginally and they go and they check and see how dilated you are, that's that cervix part that they're checking. And then there is the actual vagina, the tunnel that is there, the opening, the hole, the tunnel that's there, and then the lips, those are the vulva, and all of those things can get cancers.
Okay.
I'm gonna close this door
Your
really quick.
internet is getting kind of choppy.
I'm going to close this door.
Okay.
All right. Is that better?
I think so. So how can women reduce their risk of developing these cancers through lifestyle changes or regular screenings?
I'm going to rewind to the last question real quick before I touch on this one because I didn't finish answering. So for the symptoms that get overlooked, bleeding is a major symptom that gets overlooked. People think that it's from stress. People think that it's nothing that's going on. And that is a symptom that gets overlooked and that should not be ignored. For ovarian cancer, sometimes you can have bloating or GI discomforts, nausea, constipation, diarrhea, changes in your stool habits. And people will often go to a GI doctor and try to figure out what's going on first, or they ignore it for a while because the symptoms are very vague, things that don't necessarily ring a red flag. And so when we find the ovary cancers, they're often pretty advanced in advanced stages. 75% of women will get diagnosed with an advanced stage ovary cancer if they are diagnosed with ovary cancer. Then the cervix, that's one of the cancers that we can catch early and that we can catch before it becomes a cancer. And that's because we do pap smears. And so now, the recommendations for pap smears, they change from year to year. But what's most important is that you see your gynecologist every year. And the pap smear is when they take that little wand and I don't know if you've seen the cat meme where there's like a toilet paper roll and the cat goes in and it's like, that's what the pap smear is like. You do not get pap smears in the emergency room. If anybody says that you got a pap smear in the emergency room, that's not true. Looking inside is not the same as a pap smear. In order to have the pap smear, you've got to have that wand that goes and that collects cells from the cervix. And then a pathologist can look under the microscope and say if those cells are abnormal or not. And so, go ahead.
I have a question. I was told if you don't have a hysterectomy, you will get cancer. Is that true or is that outdated information?
No, that is outdated. You are fully fine to go to your grave with your uterus. It does not have to come out, but it does have to be checked. Somebody should be looking down there every month, and not every month, every year. And you should be looking at what you can see, the lips and stuff. You should be looking at that every month or two. Little skin changes here or there. People will often think it's nothing and they'll put little creams on it. And before you know it, they come into my office with a full-blown cancer and they're embarrassed and worried.
So what specialized services does Women's Hospital offer for women diagnosed with gynecological cancer? And how does a woman support patients and their families throughout the treatment journey?
So we offer a full gamut of services. Women's Hospital employs now 4 GYN oncologists. And so those are doctors like me. We specialize in the surgery for these cancers because most of these cancers will involve an element of surgery. So we specialize in doing the surgery and then following the woman over the course of her lifetime. Then we also have medical oncologists. Those are the chemo doctors. And we have radiation oncologists. Those are the radiation doctors. And we work with both Mary Bird Perkins and Our Lady of the Lake to staff those services. But everything can be done at Women's Hospital. You can come to one place and have everything done. And then you can come to Women's and have surgery, or then go back and see your chemo doctor in Zachary or Opelousas or Hammond or wherever you live, whatever's more convenient for you, because there are not a lot of us surgeons in Louisiana. We're at Women's in Baton Rouge. There's are 1 or 2 in Shreveport, and then there's like 10 in New Orleans. But that it's just a few of us that service the entire state. Women's also has a nurse navigation system. These are nurses that are specialized to help you get all through the system. each step of the way, somebody you can call and ask questions to and make sure that, everything is moving seamlessly, because there's a lot of moving parts in cancer treatment. So these navigators help to make sure that everything moves seamlessly throughout the process. And we've got social workers, we've got a dietitian, nutritionist, we've got a physical therapy team. Everything that one might need for your cancer treatment is on our campus.
Now I have a question for you.
Yes.
One of the ways you say you can detect something is wrong is from bleeding. Now I'm going to bring my personal story into it. I take a pill every day, progesterone, to stop bleeding. So if I don't have that indicator, how would I know that something is wrong?
If you bled through your progesterone, that would be an indicator. And then also, what is the reason that you're on the progesterone? Everyone's reasoning and why you're taking it might be different. If you're taking it for contraception, then
No.
that's one thing. If you're taking it because you've got heavy periods and you want your lining to be thinner, that is another thing. And you would need to make sure that you spoke with your gynecologist to make sure that you've had a biopsy. For women over the age of 35, specifically Black women over the age of 35 who have heavy, heavy bleeding, irregular bleeding, that some women will bleed 2-3 weeks out the month and then miss some time and then go on and on. You need a biopsy of that uterus just to make sure there are no abnormal signs in there. And some of those risk factors, if you're heavy set, a little overweight, if you've never had children, there are a few more risk factors, but those are the major ones that cause you to have an increase in that hormone estrogen, and that estrogen works on your lining and makes it grow fluffy and thick, and that can lead to heavy bleeding. And so the progesterone that your doctor has given you is to balance out that estrogen so that you have the two hormones working together instead of the estrogen driving the force.
Yeah, I bled for 2 months straight, and it was heavy clots, not to, but we need to talk
They're
about
keeping
this.
it 100. This is the problem. People don't like to talk about vaginas.
Right. And so I was bleeding so bad, I became anemic and pale. And so that's why I'm on the medicine. But I mean, should I be on that medicine the rest of my life, or am I a candidate for a hysterectomy?
You're probably a candidate for a hysterectomy. I don't know all the details of your backstory, but theoretically, you would be a candidate for a hysterectomy.
Okay. So somebody asked the question, what is the age you should get your first pap smear?
So there's a governing body called the ASCCP, and they study pap smears and cervical cancer and women with cervical cancer. And they give us the guidelines, and they change often. I actually have an app on my phone. I pay $10 for it. I check it all the time just so that I can keep up with these guidelines. But I think currently the age for the first pap smear is 21. Now this is important because they used to say that your pap smear should happen 3 years after you start having sex, which could be a variety of ages for a lot of different women. And that's because cervical cancer is related to a virus called HPV, or the human papilloma virus. And so they're saying, okay, most of us, 90-something% of us, will come into contact with that virus if we've had sex, as long as except for the two virgins who have married each other and they haven't touched anybody else, like no heavy petting, no nothing, they're safe. The rest of us, it's too late for the rest of us. We will come into contact with HPV. But our immune systems will clear the HPV, just like the flu. Like you'll get sick with the flu and then you cough, you get over it. Your HPV should normally be cleared by a strong immune system. It can, however, lie dormant in your bloodstream. And then when you are pregnant or under stress, not sleeping a lot, getting sick for other reasons, basically your immune system is compromised, and that HPV is like, ooh, I'll wake up and cause trouble now. The good thing is that takes a long time for those cells to become abnormal. The bad thing is that people will have their last kid at like 30, 35, and then they don't go back. They don't come back to us. They're like, deuces, I don't want anybody up there anymore. But HPV is like, well, I'm here. and I'm gonna sit here and I'm gonna wait till you're going through some stress at work. I'm gonna wait until you pick up smoking and I'm gonna eat that tobacco and I'm gonna do all this stuff. And then one day pop up in my office at 45, at 50 with these big fungating cancers. And then I can't do as much as I would have liked to have done when it was just a little cluster of abnormal cells. You let me catch it early, you get to keep your uterus, you get a 1-day surgery, we fix the problem. You come in, it's a big fungating mess, and we're having different conversations.
Well, I will say too, some people don't want to come because it hurts. I know I had to come get a biopsy. Those biopsies hurt.
It's true. Everything hurts. It's true. I don't like to go to the dentist. That hurts. But we still go because nobody wants to have a mouth with gross teeth. The last thing you want is a vagina that is inhospitable. So it is momentary. It is momentary discomfort for a long-term gain, because what hurts more than that is cancer.
So you would make an appointment with you, not just for a pap smear. You would get an appointment with you if you see something abnormal. Are you the next step from the regular gynecologist?
I'm the next step from the regular gynecologist. The regular gynecologists are, or I wouldn't call them regular. The general GYN, the general gynecologists are the gatekeepers to me. So you don't come to me unless you have a problem. Like, nobody wants to see me. They come, by the time they come, they read on the door. They're like, oh no, why am I here? But if you go to your general gynecologist and if there's a problem, they then send you to me. But you can also go to a nurse practitioner, sometimes GI doctors, emergency room doctors. What if you have a diagnosis of cancer, you have a suspicion of cancer, like another physician suspects that there's a GYN cancer there, or if you need a complicated surgery. Sometimes we do benign complicated surgery. Sometimes people get masses that they can find. They go into the emergency room where they're doctors for pain. They get imaging that shows a mass in the pelvis. And then the mass looks scary on the imaging. And then they send them over to us so that we can take the mass out, so that if it is cancer, they've had the appropriate surgery done by the appropriate person.
So what message do you have for women in our community about the importance of regular screenings and being proactive about their health?
Girl, that's my whole shout it from the mountaintops. And that is the message. You need to have your regular screenings. You need to have a gynecologist that you trust. If you trust this person, then you're not going to be afraid to go there once a year and open your legs. You got to do what you got to do if you trust them and trust their opinion. So that is most important, that you develop a relationship with a general GYN doctor that you trust. You have to take note of what is going on in your own body. You can't be like, oh yeah, there was some bleeding here. I don't know when it happened. I don't know how long it was. Blah, 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 blah. You got to pay attention to what's going on in your body and then tell somebody about it. Even if you don't have a general GYN doctor that you trust, tell your auntie, tell your mama, tell your sister, talk to one of your close girlfriends. Baton Rouge is a small enough place that everybody knows somebody and can help get you to the right place. Women's Hospital has, I don't know, there must be like 50 or 60 general GYN doctors that have privileges and work there. So even if you just call the hospital, go to the website, I need a doctor, and you can find one.
Now, you said bleeding is an indicator that something's wrong. What about just spotting? Spotting too?
If you are spotting after menopause, if you are spotting after you have sex, if you are spotting in between periods, those are all reasons to talk to your gynecologist.
Got it. Now, Women's Hospital has some upcoming events that you would like to share with us?
I am supposed to tell you about an event.
Well, we need to come back to that.
It's on September 28th at Southern University. Oh, there was the bust out breast cancer thing, and then they're hosting something at Southern University. I got so caught up with everything else, but I'll be there on September 20th. Just be on the lookout. Something is happening September 28th. Okay. That is raise GYN cancer awareness and just GYN awareness overall. to encourage women to see something and say something, talk to each other, make these conversations less taboo. Like, yes, we have vaginas, they bleed. Let's talk about it. You know,
Now we talked about breast cancer, but is it a connection? Like, could somebody have it in both places? Does it spread
yes,
across your body?
it can actually. It can. So, can it spread? That's called metastasizing. Sometimes a breast cancer will spread to the ovary. That can happen, but that doesn't make it an ovary cancer. That makes it a breast cancer that is in the ovary. And then also breast cancers, there's a certain, I think Dr. Bowie was talking about the genetic component for maybe 30% of women. 10 to 15% of women will have a genetic component for ovary cancer, and maybe about 10 or less percentage of women will have a genetic component to the uterine cancers. So if there is a lot of cancer in your family, if there's a lot of breast, a lot of ovary, a lot of pancreas, or if they're in young members of your family, if there's a lot of colon cancer, all of those things can be related to a genetic mutation. One misconception is that Black people don't get these genetic mutations. Like BRCA, we see Angelina Jolie talk about BRCA mutations and what she got, and everybody thinks that's a very white thing. Since I used to think it was a very white thing, to be honest. And then I moved here to South Louisiana and saw lots of Black women with BRCA1 and 2 mutations and with Lynch syndrome, which is the uterine cancer mutation. So I think that's a lot to remember. I think the take home point is if you have a lot of cancer in your family, or you have men with breast cancer in your family, or you know that multiple women have had hysterectomies and you don't know why they've had the hysterectomies, all these little things, because again, we don't talk about everything. And people don't know their whole stories and people don't know their whole histories. But if something seems a little odd to you, bring it to your doctor and see if you're a candidate for genetic testing. People don't like genetic testing. They think it's going to affect their life insurance. They think it's going to affect X, Y, and Z. But it can also save the women that come after you in your family and alongside of you.
So one more question. I know I could talk to you all night, but I'm not. I know
It's
you got to
okay.
get to your kids.
The baby has quieted himself. I'm good. We can talk.
So in terms of low income people that need screenings, I usually see mammograms on buses where you could get one for free. But how do you get a pap smear if you don't have money?
Honestly, pap smears are not very expensive. And Women's has been doing a pap smear-a-thon, a papathon, basically, where they have partnered with multiple insurance companies. They have partnered with multiple insurance companies to provide pap smears to women who otherwise would have a difficult time getting pap smears. Also, Medicaid covers all of those screenings for free, for whatever it is covered. And many of the doctors at Women's take Medicaid. Not only do the physicians who practice there or have groups there, but LSU has a residency program that operates through our hospital, and they have their own clinic that takes Medicaid and underinsured patients. And they have a whole financial sector to help patients who don't have insurance get insurance. And so don't count yourself out.
Okay, well, that's very good information. So, are you taking new patients? And if so, what I was about to say, but we can't just make a appointment with you. So, if you are taking new patients, we have to go through referral.
Correct. But people do self-refer, and we have our practice is for surgeons, but we also have a nurse practitioner who sees new patients, and sometimes she is our gatekeeper. When people will come in and say, well, I need a gynecologist, I know something is wrong, I don't have anybody to refer me, providing they go through whatever insurance hoops they have to jump through, they can oftentimes start with her and then get to us through her if need be. We are always taking new patients. We're cancer. We can't close. So no matter how booked we are, we will find space for you and do whatever needs to be done.
Well, thank you so much for talking with me this evening. It has been a pleasure, and I hope we can do more with you so we can, inform our community.
Absolutely. GYN cancer is a very vast topic. I've got all these different body parts to talk about, so I can go on and on forever. But I would love more than anything to make sure that our Black women in Baton Rouge are well taken care of and are taken care of by that have someone on their team that looks like them, if that is something that they desire, and that they know where to access resources, and that we don't have to hide or keep secrets. If something doesn't look right, something feels funny, you make your way to a physician.
Absolutely. Well, thank you so much. I enjoyed speaking with you, and you enjoy the rest of the night with your family.
Thank you so much, ladies. Thank you. Thank you. Y'all have a good event, and I will probably see you in October.
Oh, awesome. All right. Thanks.
All right.
Bye-bye.
Bye-bye.
And I'm going to bring up to close it out with our health committee chair. This was a good show.
Oh my goodness, she was. Dr. Bowie and Dr. Cowan was wonderful. She hit on some taboo topics that the Black community is very, very afraid to touch, and I'm so glad that she came on tonight. I am so excited.
Yes, and so now I got to go schedule a mammogram and a pap smear.
And
I'm at risk for everything.
I almost said, goodness, we doing breasts. We might need to do some Vagina Chronicles series or something going on, because she had everything, hey, the health committee, we're going to have to touch everything from the head to the bottom, all the way down.
Yes.
Honey, we're going to cover it.
Yes, because people need to know this.
They need to know this, and they need to teach their young girls about this, their daughters, their mothers, their sisters. We need to know. We need to know this information. This is going to save some lives right here.
Yes, absolutely. Well, thank you for all of the amazing work you're doing with the health committee. You're spearheading these programs to inform the Black community and advocating for health in the Black community. So thank you, and thank you for bringing these amazing guests to our platform.
Oh, no problem. No problem. It's an honor. It's an honor to bring this information out to our community. They need it. Like Dr. Cohen said, we need something from the rooter to the patootie. So we're very excited with this Pink Fascinator tea coming up. Don't forget to buy your tickets before they sell out, to buy a raffle, and also to vote for the bus bride event with Women's Hospital. We look forward to seeing everyone on October 5th, and also at our future events that's coming up next year that we're going to be doing. So be on the lookout on Facebook with us, with the health committee.
And I'm looking at the Eventbrite. It's still 15 tickets left. So make sure you get your ticket tonight or you're going to miss out. 15 tickets left and it's sold out. So thank you, Angela. And we will be, we'll have another show because the health committee is doing so much. So we'll have more of these topics.
We'll be on again.
All right.
Thank you. Good night.
So thank you to my guests this evening, Dr. Mindy Bowie and Dr. Renee Cowan, for being my guests on this show. Thank you for all the phenomenal work you're doing, and thank you for supporting our organization. And to stay up to date with everything we have going on, make sure you visit our website, ncbwmetrobr.com. There you can find out our initiatives, not only for the health committee, but for all of our committees, our upcoming events. You can even give a donation. If you want to support or reach out to the health committee, reach out at health@ncbwmetrobr.com. Besides breast cancer and cancer, one of the another initiatives coming up is HIV/AIDS. Also, we have a big health fair coming up. So the health committee is always looking for sponsors and vendors. So make sure you connect with the health committee. And while you are on our website, make sure you subscribe to our newsletter, and you can get our newsletter weekly to know everything that we have going on. I've been your host this evening, Shanice Lewis, on behalf of the Metropolitan Baton Rouge Chapter and President Courtney Hunt. Thank you for tuning in to Keeping It 100 Coalition Conversations. And until next time, God bless.